In recent years, concerns have been growing about the mushrooming of unaccredited nursing schools in Namibia and a trend that poses a serious threat to the quality of healthcare delivery in the country. Now, the Namibian Nurses Union has been at the forefront of raising alarm on this matter, stressing the urgent need for stronger regulation, entry tests and safeguards to ensure that only competent and well-trained nurses enter the profession. This morning, I am joined telephonically by the Secretary General of the Namibian Nurses Union, Junias Shilunga, who will shed more light on these challenges and the actions needed to safeguard both the nursing profession and the lives of patients across Namibia. Good morning, Mr. Shilunga, and thank you very much for joining us this morning.
Yes, good morning, and good morning to your listeners.
Now, could you please talk to us about why this issue of mushrooming these healthcare services or institutions that are unaccredited a concern for the health sector?
Yes, the issue of unaccredited mushrooming of healthcare standard training institutions really impacted quality of care, especially in different ways, especially that they are unregulated and they are producing more nurses that they are throwing to the streets, also creating unemployment, also creating half-baked nurses because of the lack of regulations. We have seen that these people are just producing nurses with unregulated. They don't even have a control of how many nurses they must produce. You'll find a small institution is producing even 100. They have intake of 100 students, and that becomes a problem not only to the state, but also when they are coming for their practical, the nurses will have to train them during their practical at the hospitals become overwhelmed because the students are a lot.
Apart from the reasons that you provided, how does this unaccredited institutions directly affect the quality of healthcare services in the country?
So, as I said, when you have overproduction of anything, it becomes a problem because it cuts on the quality. There's no way you can tell us that you have 50 training centers which are producing nurses. The question comes to say who are the lecturers, who are the teachers of these students, and what type of qualification do they have, and how are they managing to impact quality knowledge in these people. So it really cuts deep and is a very serious issue which need to be addressed because it really compromises the patient safety, patient care, and everything. And that is where we find now that even us as the union, we are also overwhelmed because we have a number of malpractice cases which are coming on our table, and that creates a bad picture for the profession.
Would you say that there are perhaps specific gaps in the current regulatory framework that are allowing such schools to operate? If so, how can they be addressed?
The issue is the absence of a clear legislation to say how many nursing institutions do we need in the country, and if we are to register, how many intakes does one institution is allowed to have, and also how many nurses do we need per intake. Such legislations are not available, and it becomes a problem. And the other thing is that on top of the legislation, which is not there, we have also different institutions which are accrediting and allowing this institution to practice. We have, for example, the Health Professional Council is mandated also to accredit. And on the other side, we have NKA, and we also have the National Council for Higher Education, which is established in terms of Higher Education Act of 2003. All those institutions are having the same mandate to accredit and also to control. But in some instances, you will find that one institution, for example, the Health Professional Council, accredit one training institution, but this training institution did not go through the NPA or NCHE. And that becomes a problem because there is a duplication of institutions doing the same function, but they lack coordination. And that brings a lot of problems to the profession.
Apart from some of these issues that you just mentioned now that exist that could cause, the mushrooming of these unaccredited healthcare centers, are there any other measures that you believe would ensure only competent nurses enter the profession?
Yes, we need to put measures in place, and one of those measures is the evaluation test, because now we are late. We don't have a legislation, but we cannot sit back. So we must emphasize on the evaluation test so that we allow only the competent and those who are able to perform to enter the profession. All what we are saying, we are calling the government is to say, establish the evaluation test for the nurses, but don't charge them a lot of money. It must be accessible to anybody, but as long as you are making sure that these people are evaluated and you are sending the competent people in the system. Because it becomes a problem when we have a lot of nurses. When we are overproducing nurses, it becomes a problem because any even half-baked nurses can just enter the system, and that becomes a problem to everyone who is going to receive the healthcare from these people. Because if the person is not well trained and you have to get access to the patient, it becomes a dangerous situation. And that is why we are calling for the evaluation test to be implemented fully, and it must be accessible to everyone. People must not be charged for evaluation tests, and it must also be decentralized to the region so that people must not travel a lot of kilometers to access this type of services. As we know that our people are going through a lot. They have already spent a lot of money during studies, and because there is also no regulation stating how much each institution must charge the students. It's a crisis everywhere, and all what we want is the best for our community that are receiving healthcare services from the state.
Now, Mr. Shilunga, you earlier indicated that this issue is of great concern, really, the mushrooming of unaccredited nursing schools. But do we know at the moment how widespread it is? And do we have any data or reports that indicate the scale of this problem?
Yeah, the data per se is, I can lie if I say I have data of how many nursing schools do we have. Because even I have one friend of mine who just opened a school recently in his garage. So we have a lot of them. Some are not even in public, and it becomes a problem. So I will be lying to the public if I say I am in possession of the data to say how many schools do we have which are unaccredited at this moment.
Now, when you indicate that you yourself have a friend who has a nursing school in the garage, for example, what role can individuals play, like yourselves, who know people, to help curb this issue?
Just repeat that question again. Sorry.
If I'm not mistaken, you indicated that you have a friend who has a nursing school that is operating from his garage. Did I hear you correctly?
Yes.
My question then is, what role can individuals play and the union like yourself in curbing this issue, seeing that you even have access to some of these individuals with these unaccredited nursing schools?
Yes. The whole issue here, the whole issue is to say there is a poor control of who must open a school, how the school must operate. It is the control is not there, and all what we are saying, we need strong legislation, strong regulations to condemn this type of fraud. These are bogus schools which are robbing our people. Our students are paying a lot of money out of desperation that one day they will become nurses or health professionals. But if we are allowing this type of fraud to continue, it becomes a problem. That's why we are calling for the government intervention. The government, especially the Health Professional Council, is having inspectors. So they must do their job. They must go out there, investigate those schools. And also the community members must also report such type of school. And also when those reports enters the offices of those bodies like Health Professional Council, they must act swiftly so that our consumers, our students are protected, and they are not just be given away to this type of fraudulent activities.
Now, beyond these regulations and operations that you are calling for from all these institutions in ensuring that they safeguard the nursing fraternity from these unaccredited institutions, how do we then protect these aspiring nurses who might unknowingly enroll in these unaccredited institutions? How does one identify that this could be to my detriment if I enroll in an institution like this? Because I'm sure they are sold dreams, and that is why they enroll in these institutions.
Yes, it becomes a problem, as I said already, that our people are also desperate. We have a lot of our sisters and brothers who are seated at home. Some are unemployed, some did not have qualifications, and out of desperation they become prey to these people, and they enroll in such school. All I can call first is the regulatory bodies and the institution which are tasked to oversee and overlook this type of schools. The NCHE and the Health Professional Council, NKA, they must do their job. They must go out there, investigate, close those schools. They have the power to do so. So, and also to our sisters and brothers who are in search of schools, I advise them that before they enroll in those schools, they must always try to reach out to either Health Professional Council or NKA. The whole issue here, out of desperation, this institution, they lie to these desperate students to say, no, we are in the process. They can even forge documents from the Health Professional Council or other institutions like NKA to say, no, we are in the process of being registered and so forth. So our students, they must inquire from NKA or Health Professional Council to see if those institutions are registered with them. And if they are not registered, the Health Professional Council must act swiftly to go close down those institutions. And it helps us from our students being fraudulently robbed of their money and just being left out in the dark. there was a case which came to our table. These students, I think they were 50. They were attending one school somewhere, and after completing 1 year, then they have to come for the second year to register. When they came there, they found a garage. So somebody was operating there, fixing cars. It was no longer a school. So that becomes a problem because we are allowing our people to, these scavengers, and to be exploited by this individual.
So what are your final remarks, sir, before we let you go?
So all I can say is that the Health Professional Council, NCHE, NPA, they must pull up their socks. We want strong institutions that are very serious to make sure that our people are protected, our patients are protected, our patients are not allowed, are not given away to these fraudulent people, and also to make sure that even the parliamentarians, they must work hard to make sure that the legislations, the legislations are in place to make sure that our people, our patients are protected. Thank you.
Very much, Mr. Shilunga, for making time to speak to us today.